Good afternoon and welcome to Jane Raybould, legislative candidate from District 28. Thank you, Jane, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers Susan DeCamp and Mike Barwig. Emily Wick is also joining us from the AARP office to assist with technical details. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Jane, we appreciate you taking the next 30 minutes of your time to meet and discuss issues of importance to the 50+ voter and their families in your district and across Nebraska. As a little bit of background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So with that, Jane, if you want to start us off by giving us a little background about yourself and your campaign, again, 5 minutes or less would be great. And then once you've completed your opening, we'll move into the questions. So welcome, Jane.
Well, thank you, Gina, for having me and the opportunity for members of AARP to get to know me better. So my name is Jane Raybould. I was born and raised in the district that I hope to represent. I have been honored to be representing this territory for almost 12 years as a Lancaster County Commissioner and now on the Lincoln City Council. So I can tell you that my constituents know me. I know them because I have been walking these precincts for about 12 years. And so it's a real joy. That is the thing I love the most, is walking, knocking, and listening to their concerns. I am a grocer. I am the second generation grocer. I work with my brother in our family owned business, B&R stores, where we have Super Saver, Russ's Market, Apple Markets, Cash Savers, and now 10 more stores in Missouri. So we're the largest independent grocery operator in the state of Nebraska. We have over 2,500 associates, and it's something that I'm very proud of and very involved in. I deal with construction and real estate issues. So I have about 35 years in the commercial construction industry, about building and leasing. So it's something I truly enjoy. But one of the things that I love the most is public service. And that's one of the reasons why I'm running. I want to continue public service in a new capacity with the state legislature. And I have been fortunate, so fortunate to have had so many wonderful opportunities to meet with all different kinds of groups and agencies so I can learn more about their issues that are important to them so that I can be ready to hit the ground running in January when I'm in the legislature. So there's a lot of things to learn, but I feel like I have a big advantage being a business owner, job creator, plus, being an elected official for 12 years.
Wonderful. Thank you so much, Jane. Appreciate the background and again, all of the service that you have provided to constituents in the city and the background that you bring. So thank you for that. We have provided you with a set of 3 questions or issues containing 4 questions pertaining to the 50+ in Nebraska. Again, looking to allot about 5 minutes for each of those questions just due to our time constraints. Our first question today is on health, caregiving, and home and community-based services, and Susan DeCamp is going to take that. So go ahead, Susan.
Okay.
Thanks, Gina. Hello, Jane. It's nice to have you here with us. And I wanted to thank you for your service on your local county and city boards. So appreciated by everyone. So as you probably know, home and community-based services, also known as HCBS, provide an array of services to help people with their daily living activities that promote independence and allow them to age in place in their own homes and communities and delay that institutional care, which is oftentimes way more expensive. Family caregivers also provide care for someone who is unable to live independently. And these family caregivers are typically family members or friends or acquaintances who often provide that care without any pay. And we have found that telehealth services can be significant for seniors, particularly in rural areas and underserved communities. And they can also provide support to these family caregivers by reducing travel, wait time, and other costs associated with caregiving. So we have 2 questions for you on this topic. Question 1, what will you do to support the 240,000 unpaid family caregivers in Nebraska by policies such as enhanced respite services, access to telehealth, caregiver education and training, and out of health or out of pocket expenses. And the second question would be, what will you do to protect and or expand the home and community-based services program, particularly in the areas of recruitment and retention of a sufficient workforce, and also adequate funding of these services that Nebraskans and their families rely on?
Thank you for the great question. I know firsthand how important it is as I watch my parents get older and how important it is to them that they stay home. It's more economical, and I know, and I watched and I helped my parents go through this process. I know my mom took care of my dad until it was physically debilitating for her to do so. And then we brought in home health services, some of which were funded and provided by insurance once when my father had a stroke, and trying to get the house more readily accessible for him, installing bars, changing out toilets and things like that, that a lot of families have to do. And it is an expense if they want to keep their loved one at home. And we all know how important it is. It's more cost effective to be able to do that. And I think you talked about telehealth, and that is, it has become so wildly accepted because of the convenience it brings, not only to the healthcare provider, but to the families that they serve. And that is something I want to continue to support. I know from having met with the Hospital Association, working with home care facilities and nursing facilities like Emmanuel, how important it is that that price of that telehealth visit and consult benefits not only that home healthcare provider, because they can get that training and understanding of how they're to help their parent or their loved one be able to stay at home, but it saves everyone from traveling, particularly in the rural communities. I know that they have been engaged and involved in this much more readily than folks that live in the urban areas. It is so fundamentally important. But what is so important is to make sure that reimbursement rate stays the same from going into your doctor's office for a visit or doing it from telehealth. And we know that several insurance companies want to try to reduce that and make a telehealth visit less reimbursable. And that is just not acceptable. And we see how families do struggle with healthcare benefits right now to keep their loved one at home. I can tell you that the cost is so wildly different. I know my mom was able to stay in her house until she was 90, and then she had a stroke and then passed away shortly thereafter. But my dad, we had to have in long-term care at Madonna, which was amazing. But you know, the cost for long-term care was $8,000 a month. And I can't think of many families who can afford something like that. And fortunately, because we were able to keep my mom at home, she was vibrant, she was active until she had her stroke, we were very fortunate. And that's something she was very adamant about. She did not want to go into a nursing facility, but telehealth is one thing that I will rally and champion for. I know I've talked to many of the insurance providers, physical therapists, and I can also tell you, talking to a lot of the home health providers out in the rural community, they're woefully underfunded in their reimbursable rates. So from nursing homes that are not being compensated fairly or adequately by the state and Medicaid and Medicare to make sure that these facilities can stay in operation. I just talked to someone last night at a fundraiser that the nursing home facility where they grew up in Nebraska was closed like 30 days ago. And we're seeing that could be one of the largest employers in that community, but that means that you have to go so much further and travel so much further for your loved one to get that long-term care. So that, from my perspective, I see it as an economic reinvestment in our rural communities. We have to compensate these healthcare providers, particularly in the rural areas, because they have to travel so far and they're not getting reimbursed for their mileage. They might have to, you know, because the organizations and healthcare providers are becoming fewer and fewer, they have to travel farther and farther to do their home health visit or the physical therapy that we know can keep these people in their homes longer and safely. So I think that was my answer to your first part. And the second part is, what can we do to protect and recruit and retain our existing healthcare providers? Well, and I know further on in the literature you provided, and I am a demographic fan. I love UNO demographics and Dr. David Droused and his, but we know from the demographic research is that we do have an aging population in our state of Nebraska, and we have a decreasing population of healthcare providers. I had a visit with UNMC probably 3 weeks ago with Chancellor Gold, talking about the crisis with nurses and trying to recruit more and more nurses. We had a nurse anesthetist at the event last night, and she was talking. I said, "Did you get a signing bonus?" And she said, "Absolutely, I got a signing bonus." But she also had many other offers. And where did she choose to want to live? She wants to live in Lincoln. And so not out in the rural communities. And I think one of the things I've seen across the board for healthcare providers and other professions, we need to have an incentive with tuition reimbursement for those healthcare professionals. And I know that Bryan Health, I believe, has a program in place already for physicians who need assistance throughout their academic career. And once they finish their program, then they have to do their internship out in the rural communities, and so that they get a flavor, and they try to rotate that. So we need to help with tuition reimbursements and incentives to encourage them to stay in place for a certain amount of time. And I think what happens from the conversation I have with so many people is that they really enjoy being in the rural communities that have all the same amenities that they love to have. And I'm talking about some of the bigger communities like Grand Island and Hastings and Kearney and even Scotts Bluff. So I think we need to tuition reimbursements, incentives, and then start earlier with high school students and having them shadow a healthcare professional and see, could this career be for them? And is it something they're interested in? And really get them on a track to complete their academic programming to become a healthcare provider. So those are just a few things that I've seen and heard that other places are doing to attract and retain. And certainly it comes down to salary. Folks expect to be able to have a living wage and to have the amenities that they feel good about raising their families in a community that is welcoming and inviting. And so I think a few other things about attraction and retention, but it's hard. We need more people in our state of Nebraska. Bottom line, we need more people to want to come and live in our state. And I know that other states are experiencing this same crisis of healthcare professionals. And we have to do everything we can to offer these incentives, signing bonuses, to really get them to come to Nebraska, because Nebraska is such a great place to raise your family with, of course, I'm bullish on Lincoln with amazing bike trails and top-notch education. But I think that's something when site selectors look to build their business or expand their business or open a business, they know Nebraska has a lot to offer. And I think sometimes we don't sell it as well as we can.
Great. Thank you for your answers, Jane.
You're welcome.
Thank you, Jane. Our second question, and we've kind of moved a little bit into this space already, but it's on nursing facility quality. And so Mike Barwick is going to take that. Go ahead, Mike.
Good afternoon, Jane. Glad you could join us.
Thank you.
Over 20,000 Nebraskans require care in nursing facilities or assisted living communities. Facilities have closed their doors, citing reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs, and RNs by 2028 to meet Nebraskans' care needs. Everyone, regardless of where they reside, deserves to be treated with dignity and respect and have access to quality medical care. Better staff to resident ratios improve the overall quality of care and well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across the long-term services and support industries. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. So the question is, what will you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement? And like Gina said, you kind of already started talking about some of those issues.
I think the reason why I'm probably jumping the gun is on those issues is because every organization that I meet with, that is the biggest crisis. They say that they are woefully underfunded based on comparison with other Midwest communities and other states that are neighbors to Nebraska. So that is a huge crisis where we're underfunding these type of operations and they can't make ends meet. And in my mind, it's all about economic reinvestment. Do we want these facilities to be able to stay in their communities? And the answer is yes, because they provide great jobs, great paying jobs to those communities. But it's a service and care that they provide to their loved ones that we should do everything we can. And oftentimes, if that nursing facility closes down, that is sort of the conduit to that local community hospital. And so what's going to happen to the community hospital next if they don't have that steady stream of patients coming through their door? So what can we do? This is really important, and one of the reasons why I want to be on DHHS and on banking and insurance, to really come together, bring these parties together to come up with equitable solutions on reimbursements so that we can allow these facilities to stay in operation. I know my uncle was in a nursing facility in Madison. It was so clean and it was so wonderful and the staff was incredible, but they also closed down, and that's heartbreaking to see when these facilities close down, and just the added burden on families. So is it going to be easy to solve? No. But if we start out compensating them fairly, that will allow them to be able to pay their employees well and not stress out their hardworking employees because they're understaffed. And guess what? The obligations and the responsibilities become sometimes too intense for some people, and they're burnout. Even if they're getting paid fairly, they're burnout because they need more staff and more staff support, because we know that the patients and the residents fare better. Their quality of life is greatly improved when there is adequate staffing, but it also impacts the workers as well. So making sure that we step up and fairly compensate the reimbursables. And number two, what I've heard also from a lot of the healthcare providers, particularly home health, but also nursing home, is that they have to really kind of argue and present all the paperwork, and the paperwork is inadequate, so they toss it back. So they don't reimburse those institutions, those facilities in a timely manner so that they can have they can forecast where their payroll needs to be and make payroll with timely payments. And so I think as Nebraska has renegotiated 3 of the Medicaid providers, I think that is one of the topic of conversations that I'd like to bring the stakeholders together to talk about, is timeliness of reimbursements, timeliness of getting it out to the healthcare providers or the nursing home facilities, because they have to spend a tremendous amount of staff time. And I've heard that some of them actually have to hire their own expediter to process and stay on top of some code that was not correct, and it snowballs on the added length of time. So I think working with them and providing the necessary time limits and caps that they have to, the processors of the Medicaid reimbursements have to do and expedite the payments, I think will certainly help. But the one thing that I'm big on is bringing all the stakeholders together and trying to hammer out these issues. Maybe DHHS is not fully aware of what the processors of reimbursements are doing. And I think if we had a better system of working and timely processing payments, fairly processing payments, that would allow nursing home facilities to stay in place. It is so tragic to see so many close in our state of Nebraska. It's funding, and again, I'm going back to economic reinvestment. If we really care about the rural communities that are a great place to raise your families, we need to have access to the facilities that help keep our families healthy. And I think is broadband in one of the other questions coming up?
Yes.
I thought so. I don't want to keep jumping ahead
Okay.
on the questions, but it's essential. We talk about if the staff is not so overstressed, there'd be more time for additional training. I see it in the grocery industry as well. We just say, thank you for working for our company. You go through orientation and like sink or swim, and we need to be better at training on our level too. And when you are so stretched so thin, it's hard to follow through on training.
Very good. Thank you for your answers.
You're welcome.
Thank you, Jane. And just to reinforce, and I think you've hit the nail on the head in a lot of your questions or the answers that you've given, but the bottom line, and as an agent or an organization that advocates for the residents, the one that always ends up suffering is that resident in the facility. When they close, the resident suffers. When there isn't enough staff, the resident suffers. And so I think you've done a great job of portraying that. And again, coming from the side of the resident and family, that's what's most important from our perspective as well. So they all kind of tie together. So thank you for your thoughts on that. Our final question for discussion today is on livable communities and helping people stay in their home. And Susan DeCamp will go back and take that one. So go ahead, Susan.
Thanks, Gina. Jane, what we call a livable community is a community that is safe and secure. And it offers affordable housing and transportation, and it provides supportive community features and services for people of all ages, particularly for elderly people who want to remain in their own homes and communities as they age. So affordable and reliable healthcare and transit options are critical to support older Nebraskans who want to age in place. High-speed internet, and here's your the point about the internet. High-speed internet should be affordable, reliable, and accessible for all Nebraskans. Digital skills development is also essential to obtaining the benefits of high-speed internet access in the home. So your final question from us is, what will you do to ensure all Nebraskans, and particularly those age 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet, including digital skills development?
I'm going to start on the last one first, because I think that's the easiest. I am so optimistic with the infrastructure bill that was passed and the commitment from the state of Nebraska to really expand broadband. We're very fortunate in the city of Lincoln. We have allo, fiber, and we have some of the fastest connectivity of anywhere in the Midwest. And so we need to carry this forward out to the rural communities, because that will also help with retention and keeping people happy in the community they live, that they have access to reliable and affordable and high-speed internet connectivity. We talked about telehealth, and that's even more important in the rural community, to be able to have that, not only for health, for education, for criminal justice processing. It is so vitally essential that we make sure that that's available. And to keep folks in their homes, again, to have that transportation need is huge. And I know as a city council member, we recognize that. And of course, in our budgets for the city council, we keep adding more and more handy vans, which people can schedule a time when they need to be picked up and taken to their appointment. I know that some people are very tech savvy and they're able to call Uber and kind of function as well as they can on doing that. But I think it's up to the the jurisdiction that they reside in to make sure that they have that option of transportation, the handy van. And depending upon their income level, it is at very low or reduced fees that can probably beat Uber. The other thing I like to talk about is aging partners. You know, I'm a big fan of aging partners and the senior community centers, which is such a great community for our seniors to go and get their socialization taken care of. But these are some things that we need to fully fund and support that the state of Nebraska, and I know they've been generous with grants, but I think with the increase in our aging population, they're going to become essential to so that they have a healthy meal, so that they can have a healthy meal with their community of other seniors. Plus, they have the programming there to help seniors know how to use the internet, how to access telehealth. And I think those are really important skill building sets that they need to do. Or they have, you know, healthcare updates on, you know, this is, you know, what you need to be aware of, or how to avoid being scammed on the phone. So I think I'm really so proud of Aging Partners and the great things that they do with trying to make sure fitness facilities are available to our seniors to keep them healthy and engaging in activities. Those are so important to make sure that the funding does stay in place in the rural communities as well. And I know the county is sometimes the one responsible for this. And I know the county does have vans that go out, and certainly in Lancaster County and in other communities, they do have these vans to help with transportation issues. Affordable housing is so critical. And I had the good fortune of talking to Emmanuel, which is really engaging and investing in more affordable housing for seniors. I know that they just took over the Grand Lodge in Lincoln, and I think they are taking over some facilities in Des Moines because they recognize they need to have all product type for our senior community. Grand Lodge is on the high end side, but you know, to have more affordable housing that is cost effective for our seniors. And that's their mission, to make sure that seniors can stay at facilities that are affordable, but keep them safe, that offer that community that helps keep them vibrant and active and engaged in what's going on in the world around them. I can tell you, as I'm walking my precincts, I am in awe of the folks that are in the 70s and 80s and 90s still at home, and they're so vibrant and active and engaged in politics, which makes it a lot of fun for me to stop and visit with them.
Thank you so much for your detailed answers, Jane. We appreciate it.
You're welcome. Well, I'm very excited, and I want to be effective when I start my new job in January, so I can help come up with solutions for these really pressing issues in our community and of course in our state.
Perfect. Thank you, Jane. As we're coming to the end of our meeting, I do want to offer just a couple more minutes to you for any closing thoughts or comments or anything you want to do as a wrap up, that as a message for our members that are, of course, our constituents in your district. So if you want 2 more minutes for anything, closing comments or thoughts, you're more than welcome to take this time to do that.
Sure. So one of the things I wanted to say is I am a member of AARP, and I can tell you that you are a trusted resource. And I think that is so important that our seniors know that they can trust AARP on coming up with the state-of-the-art medical treatments, how to stay safely in your home. I get the magazine. I love reading it. And, you know, as I'm going through the aging process, I think of my parents. I think of how can I adapt my home so that I can stay in it longer. And I know that these issues are so important because of the increasingly larger and larger demographics of seniors in our community. And so I want to be an advocate. I want to help out wherever and whenever I can. I usually quote President Jimmy Carter on, like, why am I doing this? And his quote is, he says, my faith demands I do whatever I can, wherever I am, whenever I can, for as long as I can, with whatever I have to try and make a difference. And so that's my real motivator to serve in the Nebraska legislature. And the one thing I know is that these seniors vote. Oh my goodness. They get out and vote. So when I ask them, hey, how are you going to vote? And they say, I've mailed in my yellow card for early voting. They're so proud and they're so excited. They say, we always vote. And so that's what I love about seniors too. They're engaged, they're active, and they too want to make a difference.
Thank you, Jane. Very true statement. The 50 plus are the ones that turn out at the polls. So I'm glad that you recognize that and that you're hearing that too. And we're proud of that. And we'll continue to hope that that continues as time goes on. So thank you again, Jane, for taking the time to visit with us. We wish you the best with your campaign. And again, thank you so much for meeting with AARP today. Take care.
Thank you.
Thanks, Jane.
Bye-bye.
Thank you.